those out into blockage strokes and then the hemorrhage kind of bleeding strokes.
Well, not all of them are fatal. Some of them can be, certainly. If someone was having one and I was in the presence of somebody, what would I be looking for?
So I think a good acronym to use, which is used around the country, is FAST, which stands for F stands for face, A is for arm, S is for speech, and then if there's any of those findings, then it's time to call 911. So that would be ask your loved one to smile. If you're alone, smile in a mirror. Even if you have to do it over FaceTime or another Zoom-like device, just to see if it's symmetric. Strokes will usually affect one side or the other. So you would see one side goes up and then the part of the face won't rise as it's supposed to.
So is this hereditary or, is anybody at greater risk? Does diet play a role in this? Exercise?
Yeah, I mean, I think it's multifactorial. I think there is inherited. I think some things are inherited, like high blood pressure, diabetes, cholesterol, which are also risk factors for stroke and heart attack. I think that plays into a role, as well as a person's habits, whether it be smoking, their dietary habits, not smoking, exercising. Those are things that can reduce our risk. But I still think anybody's at risk. We just try to reduce those risks as much as possible.
Well, it's something you don't want to think about happening, but it is good to be able to recognize those early warning signs, and getting medical treatment as soon as possible is certainly helpful. All right, doctor, thanks very much. We appreciate your time on this topic today.
You're welcome. Thank you very much.
Take care.